Hey everyone, it's Drew here at ASAP's 2018. I'm joined by Dr. Mattos from Brazil.
Again, since last year we met in San Diego.
How's the last year been for you?
Yeah, it was a very important year because I worked a lot. I've been through this, traveling a lot from Rio to Dubai all the time. And
yeah, I follow you on LinkedIn and I always see you're all over the place. So you have a practice in Dubai and then in Brazil as well, right?
Exactly,
okay,
exactly.
Cool. And your specialty is the Brazilian butt lift?
Yes.
Amongst other things?
Yes, mostly my specialty is facelift and body contouring.
Okay.
But the Brazilian butt lift is becoming international. Everybody wants the Brazilian butt lift.
Yeah.
And one thing that's very much important is that the Brazilian butt lift has this name not because the Brazilians has this butt.
Okay.
Because it was a.
But they do.
not all of them.
Okay.
So we are doing this also in Brazil a lot because they are looking for this kind of result.
Yeah.
But this technique was described by a Brazilian doctor in the middle 90s.
Gotcha.
That's why it has its name.
What was his name?
Toledo, Dr. Toledo, which is actually also based in Dubai.
Okay.
He's based in Dubai. I'm based in Rio, and I travel to Dubai.
Awesome.
This year I've been there 3 times because I was lecturing also in a very huge meeting in Dubai Dharma. It is the biggest meeting in that area, 15,000 attendees.
Wow.
And I talked a lot in this meeting, and so that's why I'm traveling so much.
Beautiful. Talk to me about the differences between, we're talking international Brazilian butt lifts here. What are the differences between, the Dubai patients, the Brazilian patients, maybe even the patients here in the United States?
You just read my mind.
Yeah.
The expectations are almost the same.
Okay.
They want bigger butts, but the fact that's in Dubai. We have 10 million, the population of the Emirates are 10 million people, but in those 10 million, 1 million is Emirati, 9 million are from other countries.
Oh, wow.
My clinic, most of the patients are from the UAE, Emiratis, and they don't have enough fat to have butts. That's the biggest problem there. Yes. Here in the United States, it's much easier because people are much overweight, and so we can remove fat and do the Brazilian butt lift.
Sure.
And also in Brazil, it's easier than in Dubai. And also the people are different. The characteristics of the skin and the body are completely different from one country to the other. Okay,
gotcha. That makes sense. So tell me a little bit about your approach and your technique. Did the techniques vary between the Brazilian butt lifts? Do you do it differently than other doctors, or?
To tell you the truth, the techniques are it's going through a change now. The society has a committee studying the safety of fat injections to the butt.
Okay.
We used to do very inside the muscle. Nowadays, you are preferring to do it very close to the skin to avoid embolism, which has caused a lot of deaths in the United States and worldwide.
Gotcha.
And the fat grafting, the butt lift, is nowadays in plastic surgery. For last years, the most dangerous surgery in plastic surgery.
Yeah.
With the highest rate of death. So that's why the technique is changing.
Gotcha.
Instead of putting the fat very deep, we are putting much more superficial to avoid embolism and avoid this catastrophic result.
Gotcha. Talk to me a little bit about the evolution of the Brazilian butt lift, because it was introduced in the 90s or something, right?
Yes, exactly. What's changing, first of all, is the technique, as I just mentioned, and the second one is the treatment of the fat.
Okay.
Because the fat will be reabsorbed by the body, and for you to see how this can be different, there are papers saying that the absorption rate varies from 10, 20 to 90%, almost all the fat.
Yeah.
So the most important thing is how you treat the fat. You have to wash the fat and prepare the fat and have a good source of fat to avoid too much reabsorption and losing the result in a long term.
Okay, that makes sense. So like you were saying too, if you don't have the fat to graft,
you need an implant.
Yeah, you need an implant. So are implants still popular? Are they still doing those now that the fat grafting is so popular?
Yeah, because actually implants, gluteal implants is very much different from breast implants. Because breast implants, we have different pockets where you can put the implants.
Is it silicone as well?
Yes, same kind of implants. But the pockets are different. In the breast, you can choose different pockets. But in the gluteal area, very different from the fat, we have to put it inside the muscle.
Okay.
We can't put it subcutaneously.
Gotcha.
So when we put inside the muscle, it keeps there very high. And so if the patient is older, the butt starts to sag a little bit. So, and it's a surgery with a lot of complications because it's a near area of contamination.
Sure.
Everything in plastic surgery, it's based in expectations and good indications.
Yeah.
If you talk to the patient, and if the patient understands what you can give her, and you follow the rules, but the techniques, then you avoid problems.
Cool. Okay, cool. I'll wrap it up with this. If you can give a patient any piece of advice, a patient who's considering Brazilian butt lift, what kind of advice would you give them while they're searching for the right doctor?
First of all, understands that everything in plastic surgery, especially butt lifts, has limitations. We can't, until this point, we can't have synthetic fat. So, first of all, we must have enough fat. Sometimes patient thinks that she or he has enough fat, but what's happening is that, as I just mentioned, we have to remove the fat, treat the fat. So not all the fat that we removed you can inject. So only part of it. So sometimes patients are confused about this indication, and also the danger of the procedure must explain to the patient. Keep safe, keeping the subcutaneous tissue, and the last resort, if she wants, we can use an implant as well. Talked about this last year. My son now this year is finishing medical residency in anesthesiology.
Okay, awesome. I remember that.
He will going to work with me next year.
Dude, no way. That's awesome. Good stuff.
And the other one is a lawyer.
Cool.
Okay. You are very nice.